So Bruce, good morning to you.
Good morning.
Thank you so much for hosting the Directors Forum last week. It was wonderful. So 20 people coming to see this business, and there's a new bit here, Bruce. This wasn't here before.
Yeah, we've had to increase the number of offices due to expected and forecast growth. So we've put in a new packing area downstairs and a mezzanine floor and new offices up here.
Excellent. I mean, one of the questions that arose last week, people wondered, the amount of regulation that seems to be in the pharmaceutical industry. How do you deal with all that?
It isn't easy, being a small organisation. If we take one example, if we look at the active ingredient of Fibrovane, this has gone from being able to buy an industrial chemical and purify it to one stage further back where we have to now synthesise the product in a approved manufacturing plant. This has had huge implications in the amount of work because any changes you make have to be fully validated. We have to monitor it all the way through the product life cycle to ensure that any changes that are being made at the very beginning of the cycle haven't affected the quality or the safety of the product.
Is the emphasis on the product, would you say, or is it a product service split? How does it kind of work, this difference between product and service for you?
Well, we've really got two income streams. One is the STD product range and the other is the services we supply for Medi. We're also continuously looking on the STD side of products that we can fit within our expertise and our customer base to try and improve our product range. I see that really developing over the next 5 years. And on the service side, we're very much in the hands of Medi UK and their sales.
And they're based in Germany, aren't they?
Yes.
And you do a lot of work overseas. I mean, lots of European countries and even farther afield, I know. I mean, how do you deal with the exchange rates?
We had a lot of issues with the euro in 2008 and 9 when there was a big step change from 1.45 down to 120. And during that time, we worked hard with our currency partner, World First, to try and hedge the currency as it went down. On the STD product side, we currently buy the active ingredient in dollars, we fill the ampules in Germany in euros, and we do the packaging in pounds. And then we sell out to countries that we're registered in euros, dollars and sterling. And so we try and balance our purchases against our sales to cover the currency risk.
Is there a trend moving away from purely business to business towards business to consumer going forward?
I believe our core business will always be in business to business, but there is a trend. STD sell a medical device for the treatment of excessive sweating. For the last 5 or 6 years we've been selling that direct to the patient, and that we've done through the website and also through recommendations from hospitals. On the Medi side of the business, Medi have been involved in medical compression hosiery for the last 30, 40 years and have a huge expertise in it. And that has led into soft bracing for orthopedic treatment. And now, most recently, they've started developing a range in sports compression. And I see the sports compression as being very much a business to consumer sale.
Hereford isn't the obvious place to an outsider. This is the point one or two people made, to be such a strongly distribution-focused company. How does that work?
Well, we currently send out between 500 and 600 parcels a day. The majority of them are light parcels, so below 250 grams, so they feed straight into the postal system. And there isn't anywhere in the country that we can't deliver to next day. I think without a doubt there are cost savings to being based in Hereford. And we have a really great, loyal, hard-working workforce that all enjoy living in Herefordshire.
That's important, isn't it? What age were you when you suddenly thought, yes, I'm going to work in the family business, or didn't it happen like that?
It didn't happen quite like that. I mean, my father as a pharmacist and Tony Leach as an accountant, and the late Professor George Fegan started the company in 1967 for the manufacture and the marketing and sales of Fibrovane. And it wasn't until 1987 when the partnership between STD and Medi started, and the business then really started to grow. I decided that I really wanted to go into a smaller business to get more involved in the business. It was at that point, this was in about 2000, that my father said to me, well, if that's what you want to do, why don't you come join us in Hereford? I think people do enjoy working for a smaller organisation that's got family values behind it.
Well, if you were to summarise, what would be the essence of the success of the business whilst you've been in the hot seat?
Very definitely the most important thing is having quality products. We've always supplied an excellent service to our customers, and all of this is only made possible by having an excellent workforce. We've always tried to be flexible to ensure that we meet our customer demands, and again that requires a flexible workforce to be able to do it.
Well, thank you very much for this interview and all the very best for the future.
Thank you, Tim.